right. It's now my pleasure to invite Courtney King, Assistant Director of Philanthropy at Rady's Children's Hospital, to say a few words and to introduce our keynote speaker, Mary Beth Moran, Director of Community Health and the Center for Healthier Communities at Rady's Children's Hospital, San Diego. Please join me in welcoming Courtney King.
Thanks, Craig, and thank you all for being here this morning. I am honored to be with all of you. You all make such a tremendous impact at the hospital and at Rady Children's here and at your local children's hospitals. You all play such a crucial role in connecting the community to the hospital, and we are so appreciative of it. As we are officially well past the 1-year mark of COVID-19, we have made significant progress in vaccinating our community. We've administered over 150,000 vaccinations at Rady Children's alone. We are working hard to help our community move back to normal. This past year, as we all know, looked like no other. And despite being dominated by a pandemic, I'm proud to share we provided uninterrupted access to care through both in-person and telehealth visits to ensure that every child who needs us receives the care they need. We know research and personalized treatment are essential to providing the best outcomes for our patients, and your generous donations are critical to our continuation of innovations in research and enhanced medical treatments to not only advance the patient care experience, but help prevent unnecessary injuries and illness for our most vulnerable populations here in San Diego. This past year, Kiwanis has made an impact in our Pediatric Trauma Center, in our Transportation Safety Program, and our Center for Healthier Communities. Your dedication to Rady Children's has been exemplified with your creative fundraising efforts in today's primarily virtual world. On behalf of all the children and families we serve, thank you for all you do. I want to end with a special thank you to Dave Schmidt, who in his decades of service, he navigated COVID-related uncertainty with grace. He kept his division engaged with each other and the hospital and was still able to inspire clubs to raise much needed dollars for the hospital. Dave, you are truly appreciated. At this time, I'd like to turn it over to Mary Beth Moran, who will share more about the history of successful collaboration between Rady Children's and the CNH Children's Fund. Thank you.
Well, welcome to San Diego. I hope that you're enjoying our weather. I say that in earnest because those of us from California and Nevada, rain is a gift. Thank you for having me this morning. My name is Mary Beth Moran. I am the director of our Community Health and Center for Healthier Communities. I've been at Rady's for 14 years, but for 11 of those years, I was the injury prevention manager, and so I got to work so closely with all of you, and all of your generous support over those 11 years really helped propel our programs. Now, as the director of the Center for Healthier Communities, I also oversee injury prevention, but all of our other programs. And I thought it'd be really important for you all to know that Rady is a really special place for many reasons, but for me, the fact that Rady Children's Hospital committed to a Center for Healthier Communities for the last 25 years demonstrates their commitment to our community and truly recognizing that healthcare doesn't just happen in our clinic, it happens with all of our community resources and support that we get. So with that, we have 5 priority areas. We of course have injury prevention, was paramount with all the work that we do. We also have an oral health division, which is sponsored by an endowment by a very generous dentist who is very committed to serving kids that are marginalized, kids that have trouble getting access to oral health, those with special needs from physical special needs to autism or kids with complex medical conditions. And that's our Anderson Center for Oral Health. We also have nutrition and healthy lifestyle. And with that, our commitment to the County Childhood Obesity Initiative and ensuring that children have access to healthy foods. We have maternal and child health, which is committed to myriad topics from supporting vaccinations, which as you know is very important these days, to reducing tobacco use in expectant and new mothers and in our youth today, to working on supporting our clinical environments with reducing asthma triggers and the need to come into the hospital for severe asthma attacks. Then we also have our youth development program, and that's something I want to focus on today, as well as our trauma program, because this year the Kiwanis have supported our youth development program with a generous gift. Our youth development programs are threefold. We support a health career pathway program at several under-resourced high schools in our area. It's called Faces for the Future. And our goal is to help these kids get a good education, graduate from high school, and begin their higher education experience and support them to enter the sciences and engage in a healthcare field. The reason is, one, we want to help support and encourage positive social determinants of health with them, getting good education, but we also have to admit, self-serving, we want to build a very culturally diverse and linguistically appropriate healthcare workforce for our future, now more important than ever. We also provide what's called medical academies. We want to encourage kids to get into the health professions and the biotech professions. We all know that without good pharmacy and with good people doing lab research, we wouldn't have our vaccine today. So we provide a summer camp, if you will, 2 of them actually. They're 2-week experiences which we immerse kids in all aspects of healthcare. And we truly immerse them. They get to practice sewing pig's feet. We take them to the UCSD Future of Surgery, and a variety of interactive activities. And again, it's not just the kids that benefit from this, but all of our clinicians that participate in these programs really benefit. They share with us that they probably get more out of it than the kids do because of the joy that the kids see in this learning. Along with that, we do some specialized medical academies for weekends to recruit kids into nursing, behavioral health, and surgery. And one other program that I think most people wouldn't recognize that we might do is we provide wellness services to the youth that are incarcerated in juvenile hall. And our role there is to support their wellness, whether it's helping them get good oral hygiene, good nutrition, deal with conflict management, all to help support their discharge from juvenile hall with the hope that we can reduce recidivism and returning back to being justice involved. And a lot of people don't realize that's part of the work that we do that, of course, is very, very important. But I'm here today to talk with you about injury prevention. There we go. Whoops. Okay, we're going to go backwards. And I want to share amongst all of our work, at the platform of all of them, are 3 things. One, we want to mitigate the impact of social determinants of health. We want to help kids get access to good food, have transportation to get to the care they need, and help build healthy infrastructure through our Safe Routes to School program so that it's safe for kids and their families to walk to and from school and other places and to be physically active and safe in their environments. We also want to build on reducing the impact of adverse childhood experiences. We want to help families build on their positive things that they all do, build on their strengths, and help identify them with resources to further support them. And then our last platform that we work off of is we do all of our work to integrate into our clinical care, and I think you'll see that the most in our injury prevention programs. So first of all, Rady Children's is the lead agency for 2 international organizations. One is Safe Kids. We're the local affiliate of Safe Kids San Diego. And we bring together a host of community members and stakeholders to identify and address our emerging trends in injury. And pretty much for the last few years, that has been drowning prevention, safe sleep, health safety, and of course our transportation safety program. And I'll be identifying a few more of those programs in a minute. The other program that we're a part of is the Injury-Free Coalition for Kids. This is a program whereas pediatric hospitals across the states convene and through collective impact, share information on the programs they do so that we can have a global impact on the work. And we share best practices. It's a wonderful organization. Locally, we've had Safe Routes to School, which is a program where we work with elected officials, city engineers, and the community to help improve the infrastructure of various communities that historically might have been redlined and marginalized, to help raise the platform and improve the conditions of which these kids live. We've been doing that for 21 years now and have had some solid impacts with improving infrastructure throughout San Diego. And also for the last 20 years, we've been very committed to child passenger safety. And we have a beautiful website and a very robust transportation safety program where we're working not only to ensure kids are in the appropriate car seat or booster seat or wearing seat belts, but also safe teen driving and bicycle safety and pedestrian safety. And the work that you all do to disseminate bikes throughout the city is incredible. It gives kids opportunities for jobs, gives them opportunities to socialize, and in some countries, it actually is a life-saving skill. So here's some of the programs that the Kiwanis has sponsored over the years. For the last 10 years, we've gotten support from you for myriad programs. We choose our program based on what is trending. And typically, throughout these years, kids under 5 are most at risk for injuries in the home. And this year with COVID, we have really seen that surge for obvious reasons. Everybody has been home more. Some of the injuries that have surged have been dog bites, because too many people in a house with the animals, sometimes the interactions aren't always favorable. So we've done a lot of education to help support families understand animals' behavior so we can mitigate that issue. We do window fall prevention, especially second floor windows, a lot of drowning prevention and water safety, and in recent years, a lot of work on safe sleep, because we found there's been some trends towards families having a family bed, and that is not always the best thing for young children. But the programs that the Kiwanis has sponsored over the years, starting back in 2011, have been things that have been sustainable. We worked with the home visitation public health nurses to educate them on simple measures to share with their clients about how to make their home safer. What are better practices with safe sleep, with water safety, with making the home environment safer so kids can learn, grow, and explore. And then from that, and I'm not going to go all of these in order per se, we have done programs where we've worked with community members to help families identify issues in their home. Most recently, this year, we have worked with our local Kiwanis to provide a transportation safety program, putting car seats into kids' cars, and it's been wonderful to engage our Kiwanis volunteers in that process. Again, a silver lining of COVID is that we have altered how we do this process. Before, we'd be getting into cars and strapping in the seat and doing everything, and now we do it external to the car. We demonstrate to the parents how to put in a car seat, and they do it themselves. So it's actually more beneficial for the parents. They get more hands-on, and I think it's more efficient. So we've all adapted to COVID, and I think some ways, I think it's propelled us forward many years to improving the processes that we do. I wanted to update you all on where we are now. I have to say, every single program that you have funded continues to this day. And I'm very proud of that because you give us seed money and we take that money and we add to it, we build on it, we integrate it into some of the other work we do in the Center for Healthier Communities. So please know that when you give us a gift, it keeps on growing and growing and growing and has a huge impact on everything that we do. One program specific I want to call out is when we hosted a Concussion Symposium back in 2015. That was one of the hallmarks of my career. I'm so proud of that symposium because it brought together families and our clinicians so they could both hear each other about what was working when they came to our emergency room and what was not working. And what bore out of that conference was some incredible quality improvement efforts and new protocols that continue today. In July, we just onboarded a bunch of new residents into our emergency department, and all of them were trained in this evidence-based concussion protocol. So it's had a huge impact on our trauma and our ED services. Our Start Safe program, whereas we go into community housing groups and we provide injury prevention education to people who have newly attained a home. These are people that were formerly without shelter and now have subsidized housing. How do we help those families make that environment safe and sustain that? That program continues because after our support from Kiwanis, we integrated that program into a program called Health Stars, whereas volunteer physicians go to these groups and provide a series of workshops, whether it be nutrition, oral health, positive parenting, but also injury prevention. So that program lives on strong. And now our Safe to Sleep program. And I have to say, this is a really important program. Suffocation is one of the primary causes of unintentional death in our kids under 1, and it's completely preventable. We have convened our partners from around the county and all the labor and delivery hospitals so we could work with the families that we all treat to give them the same message and the same support about how to put your child to bed safely every night and good practices. From that, all of our contributing agencies, that's Scripps, Sharps, UCSD, and Rady Children, have been awarded a credential through a program called Kids for Kids, whereas they have a certain kind of gold star of excellence for providing safe sleep measures for kids. And that is huge. From that, we started sharing this information through the Injury-Free Coalitions for Kids to form a national coalition to help spread this message to hospitals throughout the country. So that is the scale that your seeds of funding do for us. It's not just here in San Diego, we spread the wealth throughout the country. And this year, you have generously supported, and are about to give us a very large cardboard check, our home safety program. And we have various different home safety programs throughout the year, and this one is targeted towards our high-risk infant program. It's twofold. We're going to be providing a Train the Trainer program for these nurses so they can continue to educate their families in some of the high risks, such as safe sleep, window falls, drowning prevention, but also providing a toolkit, those resources that they can gift to their families to further support them. And then in addition to that, we're going to do 10 virtual trainings. You know, Zoom isn't all bad. It allows us to scale our work, to provide this education to people who might not be able to travel to us. So we're going to do 10 virtual trainings with the aim of bringing in 15 families per training. So that's 150 families that are going to get this education. I read a quote that COVID has propelled our technology 10 years into the future because we've all been forced to adopt and integrate it. And I think that's true, and it's definitely been true for the programs that we do at the center. COVID has kind of clipped our wings a little bit, but we've adapted, and now we're back to providing services in a way that we didn't before. And as I've given some examples, sometimes it's better. And we've been forced to make an adaptation that has actually improved our service. So that is how you have generally supported what we do in injury prevention, supported our trauma program, helped our clinical care. In addition, this year, I know you all very much support youth development. Kiwanis generously gave us $10,000 to help support our youth development program. And we used those funds to help give tools for our students to practice what they're going to be doing in the future. Stethoscopes, blood pressure cuffs, all of that, so they could practice their physical skills clinics with us. And that is enormous because a lot of these kids go home and they regularly monitor their family's blood pressure, which is so life-saving. They learned CPR, they learned first aid. And so not only helping us with our trauma program, but helping us with our youth development is going to grow our workforce and improve our trauma programs well into the future. So from the bottom of my heart, I thank you so much for all of the support that you've given to the Center for the Healthier Communities and for the hospital and for our kids in San Diego. So thank you so much.
All right, thank you, Mary Beth. If you could stay on stage with me for a moment, and Courtney, if you would join us again on stage. I'd also like to ask our SLP governors to join us at this time. Friends, if you haven't heard the news, your generosity enabled the Cal-Nev-Ha Children's Fund to award nearly $115,000 in grants to our partner hospitals this year. Our partners in Honolulu will use their grant funds to provide advanced pediatric trauma care to children recovering from a traumatic brain injury, while our partners in Oakland, Loma Linda, Madera, Reno, and in San Diego will use these funds to expand their injury prevention programs. Specifically, Rady Children's Hospital will use these funds to implement the Kiwanis Home Safety Program. The Kiwanis Home Safety Program aims to prevent injuries for the most vulnerable children and high-risk families. This partnership between Rady Children's Hospital and the CNH Children's Fund will make a tangible difference in reducing the injuries and fatalities, providing free educational training to high-risk families and supplying them with the tools they need to improve the safety of their homes at no cost. Leveraging the commitment of the CNH Children's Fund to reduce childhood deaths from trauma and the expertise of Rady Children's Center for Health Communities, this program endeavors to build a better future for children by giving this community the tools and education they need to live safer, stronger, and healthier lives. The Cal-Nev-Ha Children's Fund is thrilled to partner with the Rady Children's Hospital, San Diego, to improve children's health and safety and to reduce the leading causes of childhood injury and death. Governors Ryan, Serena, and Amy, would you honor us by presenting the Rady Children's Hospital with their grant check in the amount of $23,000? Mary Beth and Courtney, thank you for joining us this morning, and thank you for collaborating with us to build a better future for our children.